Hey again, folks, it's Dr. Mike. We're back here again for our tip number 22 in our medical exercise training 101 ebook series. Now, if you don't mind, we're going to do this the same way. I'm going to read the tip, then we're going to talk about it, but please make sure you go over to met101ebook.com, download your free PDF of the manual. It's 101 tips, and I guarantee it will help you in building your practice, whether you are a medical exercise professional, or maybe you're a physical therapist adding this, or a chiropractor, or maybe you're in a hospital-based fitness facility and you want to add medical exercise training, or actually add it and manage it at a higher level. I think these will help you. So if you don't mind, let me read tip number 22, then we'll talk about it a little bit. What areas can I specialize in when I open my practice? This is an individual opening a medical exercise training practice. I think the idea of specialization in medical exercise training is fantastic. Specialization in this arena doesn't mean you can't see clients outside your specialty area. That's important. It simply means you have a very high level of knowledge and expertise in that area. In the medical community, this means a patient load focused in your specialization area. But in medical exercise training, specialization, you enhance your skills and knowledge across the full spectrum of clients that you'll manage. Now, notice I use the term patient for the medical professional and client for the medical exercise professional. Specialization is a good thing. Don't look at it as a limiting factor. I've had many medical exercise specialists say, well, Dr. Mike, I don't want to specialize because that means I can't see other clients with other conditions. No, it just simply means you have a greater understanding in this one area. But folks, I guarantee you this thing that you're working on is the human body. The more I know about one system, the better I understand all the systems. Because this is an engineering masterpiece. If I understand one, there's got to be carryover to others. So please, I recommend that you look at developing maybe 2, maybe 3 specialty areas, and don't just simply limit yourself to just those areas, but focus on those areas. And I guarantee you, when clients come in with conditions that are outside of those areas, you'll probably have a better understanding, if nothing else, to understand when you need to refer them to someone else. So let's talk about some of these specialties. I recommend looking at medical exercise training specializations in the following areas: cancer, total joint replacements, post-operative shoulder, that means after physical therapy and everything is done. Post-operative spine, again, after physical therapy and everything is done. Post-operative knee, whether it's a total knee, an ACL reconstruction, a meniscal tear. Also, neurology. Folks, that's a huge area now. One of our medical exercise specialists and a good friend, a medical exercise program director and a colleague, Andre Gramion, started a medical exercise training clinic on Saturdays at Medical Fitness Pros here in Katy, Texas. He only sees neuro clients, Parkinson's, MS, stroke, as well as a wide range of others. One of the things that we've done is we sometimes forget about the neurologic client. And this neurologic client has neural deficits, but folks, in many instances, their cognitive capabilities are still there. They still have great possibilities. And with that, they need an ongoing exercise program. One of our medical exercise specialists recently in our MES Masters training presented an individual who is a physician that sustained a stroke. This individual just wanted to have some training to increase his level of endurance, but also to work on his visual acuity, particularly his peripheral vision. And Andre, along with Justin, and I gave a little bit of input, we actually helped this individual improve his peripheral vision, which in turn helped his overall visual fields, and it made a huge difference for him. So there are a lot of things you can do, but forgive me, let me finish talking about these specializations. Osteoporosis, OBGYN, bladder control and incontinence, athletic transition from the injured athlete back onto the field, hypertension, diabetes, obesity, aquatic exercise. I have a very good friend and longtime colleague, Ricky Gross in Toronto, Ontario, who specializes in just aquatic exercise for clients with that are coming in for medical exercise services. So the need is huge out there. And please, let me finish. Medical exercise management is the use of exercise to augment and support medical care. It doesn't take the place of physical therapy or chiropractic or anything else. It augments those services. Once you specialize as a medical exercise professional, you are now responsible for every aspect of the client's exercise programming. In addition, you now share information and collaborate with the client's medical providers. Not as a trainer, but as a medical exercise professional. It's a different level, folks. You are managing the exercise aspect of their care. You have the confidence to manage every aspect of the client's exercise program and confer with their medical professional or professionals. You will share information and you make the exercise recommendations to the medical providers. Folks, you're the expert in exercise. Confer with the doctor, the therapist, the chiropractor. Give them your recommendations. They may come back and say, hey, we want to try something a little different. That's fine. But don't just simply ask for referrals and ask, what should I do? Be part of the proactive process. Say, here's what I think. Here's what we might want to do. This is the key shift to medical exercise training from personal training. You are the exercise expert. Its application to the client's medical condition is really based on some of your recommendations. This is why your specializing is so important. Don't just take a few additional workshops. Master the information, apply it to your clients, and track the outcomes to determine which combinations of techniques produce the best results. Folks, this is all about outcomes and all about results. It's not just simply giving the client an exercise program and they feel better. What's the most effective? What's the most efficient? What produces the best outcomes? Now, you report and share these findings with other medical exercise professionals once you've reviewed and verified your findings. The best forum we have right now at this point would be our MedX Pro Summit or our MES network or Medical Exercise Specialist Network to get in there and share what you're doing. Folks, I think the days are done where medical exercise professionals are lone rangers. You're out there doing it on your own. And it becomes important that we share information, our successes, but also our failures. And I know a lot of you don't want anyone to know you don't know what to do with a particular type of client because you feel another trainer is going to steal it from you. Folks, the medical community has been faced with this situation for eons. And the key thing that medical professionals do is they come together and they do case conferencing where if you got 6 medical providers in the room, that's 6 brains compared to just your one brain trying to figure it out. So in the medical community, we do this on a regular basis. I'm hoping that we'll see this more in our Medical Exercise Specialist Network through our MES Masters program that meets every other Thursday evening, where a medical exercise professional from around the world is presenting a challenging client. So please go over to mesnetwork.org to get more information, or shoot me an email at drmike@postrehab.com and ask me about our MES Masters training series. So with that, thank you again for watching. Stay tuned for more tips, and make sure you go over to MET101ebook.com and download your free copy. All the best. Take care.